Welcome to the deep dive. Today we're looking into something that feels really cutting edge.
Hmm.
It's this idea of using young plasma therapy to maybe potentially reduce inflammation, especially, as we get older.
Yeah, it's definitely got that intuitive pull, hasn't it? The idea that younger blood might have some restorative properties.
It really does. So you're joining us today, listener, and our mission really is to cut through some of the hype.
Yeah, to see where the actual science is.
Exactly. Where does the science currently stand on young plasma and inflammation? We're going to focus on, the credible scientific concepts and the evidence we actually have.
Sorting hope from fact.
Right. And to do that, we've been digging into some pretty interesting research excerpts that look at this young plasma therapy idea and, well, the whole complexity around inflammation.
Which, as you'll see, paints a picture of some promising ideas, but also some very real challenges.
Okay, so let's try and unpack this. Maybe a useful way to get our heads around it is to, imagine a study, a hypothetical one. Let's say there's a trial using something. Let's just call it GRF 6021 for now.
Right, a placeholder name.
Yeah. And this GRF 6021, it's a 5% plasma protein fraction. So a specific part of plasma taken from younger donor.
Okay, younger donors, got it.
And it's given to older patients, maybe people recovering from, say, hip or knee surgery, orthopedic surgery.
Right, a situation where inflammation is definitely a factor post-op.
Exactly. And this imagined trial, it would need to be really rigorous, randomized, double-blind, placebo-controlled, the whole setup.
That's crucial. That kind of design, that's how you minimize bias and really see if the treatment itself is causing an effect.
Precisely. So in this hypothetical study, what might researchers actually observe? Well, they might find that this GRS 6021 actually influences the immune system
Oh, so?
by modulating inflammatory pathways, specifically within our adaptive immune cells, the ones that learn.
The targeted response cells.
Yes, and we're talking about specific signaling pathways, things like JAK-STAT and MAPK cascades.
Okay, yeah, those are definitely known players. They're like central regulators for how our bodies handle injury, infection, inflammation generally.
Right.
So tinkering with them, I mean, that could theoretically have a noticeable effect. And because those pathways are involved in so many inflammatory conditions, a therapy hitting them could be pretty significant.
And here's another potential finding, maybe even more interesting. The hypothetical results might show that the patients who got the GRF 6021, they needed less pain medication afterwards, less opioids, for example.
Okay, so potentially better pain control.
Which could be linked maybe to less inflammation overall, not just at the surgery site, but systemically.
That would be a very positive signal, yeah, suggesting a broader effect beyond just the local area.
Now, and this is really, really important to stress.
Okay.
No specific study with all these exact details, GRF 6021, the orthopedic surgery context, the specific results, none of that has actually been published as of, May 2025.
Right. So GRF 6021 is illustrative. It's not a real product we know about.
Exactly. It's just a framework, a way for us to talk about the kind of research that might happen or is being explored.
It lets us discuss the science underneath without getting hung up on, say, one specific early stage study that might not pan out.
Right. But the fundamental idea, using parts of younger plasma to affect inflammation, that does have some biological basis, doesn't it? It's not completely out of left field.
Oh, absolutely. Like we said, those pathways, JAK-STAT and MAPK, they are well-known regulators. They control immune responses, inflammatory responses. So the hypothesis that something in younger plasma could interact with them beneficially, that's scientifically logical.
It makes sense to investigate it.
Definitely a reasonable path for research.
And the focus on plasma fractions, like that hypothetical 5% protein bit, that seems important too. It's not just about giving someone whole young blood.
That's a really key point. Refining it down, trying to isolate active components. The goal there is to concentrate potential benefits and, crucially, reduce potential risks. Well, yeah, whole plasma is incredibly complex. Introducing all of that from another person carries risks, immune reactions, disease transmission, other unforeseen effects. Fractionating it is a more targeted, potentially safer strategy. It's almost like developing a specific drug from a natural source.
Okay, so the basic science seems plausible, but like you mentioned, there are challenges. What are some of the big hurdles or caveats we need to keep in mind here?
Well, there are quite a few, actually. A major one is sample size in the studies done so far, or even in hypothetical ones like our GRF 6021 example, if it only had, say, 30 or 40 people.
Right, and 36 isn't huge.
Exactly. With small numbers, you have low statistical power. It's harder to know if an effect is real or just chance, and even if it seems real in that small group, you can't easily generalize the findings to the wider population.
Makes sense. What looks promising in 30 people might vanish when you test 300 or 3,000.
Precisely. Then there's another big challenge: figuring out what exactly in the young plasma is doing the work.
The active ingredient.
Yeah. Plasma has thousands of proteins, lipids, metabolites, all sorts of stuff. Pinpointing the specific molecule or molecules responsible for any benefit is incredibly difficult.
It's like trying to find the one magic ingredient in a giant complex soup.
It's a good analogy. And until you know what that ingredient is, it's hard to understand the mechanism fully or to develop a reliable, standardized treatment based on it. You're kind of working in the dark.
Okay, what else?
Then there's the whole question of what young even means in these human studies.
Ah, right, you mentioned that earlier.
Often when you look at human plasma studies, the young donors might be people in their 30s, which is, young-ish.
But not necessarily a teenager or someone in their early 20s.
Exactly. And this is quite different from many of the animal studies, particularly in mice, where they often use very young donors, sometimes equivalent to human infants or children. And those animal studies sometimes show more dramatic effects.
So the young in human trials might not be as biologically potent, maybe, as the young in some of the animal models?
That's a possibility, yes. Or the effects might just be different. The point is, the definition isn't always consistent, and it matters for interpreting results and comparing studies. We need clarity on that.
And thinking about practicalities. This isn't something people can just, sign up for at a clinic for anti-aging, is it?
Absolutely not, and that's a critical point.
Yeah.
The US FDA, for instance, has actually issued warnings against using young plasma infusions for unproven anti-aging treatments or other conditions outside of rigorous clinical trials.
Because the evidence just isn't there yet.
Exactly. They emphasize the lack of solid scientific proof for these kinds of uses and also highlight potential safety risks. It really underlines that this needs proper evidence-based development, not just jumping ahead based on hype.
Okay, so let's try and summarize. If we take a snapshot right now, May 2025, where does the research on young plasma and inflammation in humans actually stand?
Well, I'd say the current state is promising in theory, maybe.
Yeah.
The biological ideas behind it are sound, interesting. Plausible, yes. But the actual evidence from rigorous, large-scale human trials, specifically looking at inflammation, it's still very limited.
So lots of preclinical work, maybe some small early human studies.
Correct. There's exploratory research happening, definitely. Preclinical studies in animals, some phase 1 or phase 2 trials, looking at feasibility or preliminary effects in small groups. But we are a long way from having a scientific consensus on whether it's truly effective or safe for widespread use in humans for inflammatory conditions.
Okay. So the headline really isn't breakthrough achieved. It's more like
intriguing area, needs much more work.
Yeah, promising biological concept, but the human evidence is still early days.
That sums it up well. Very early days.
Right. So for you, the listener, just to wrap this part up, the core idea, using young plasma components to fight inflammation, it's definitely captivating, and the underlying science has a certain logic. Maybe younger blood does have factors that can modulate inflammation.
It's biologically possible.
But, and it's a big but, the human evidence is preliminary. We really need those big, well-designed trials, studies with clear endpoints, studies that really nail down how it's working before we can say anything definitive about safety or efficacy.
Absolutely. The burden of proof is high, as it should be.
Which leads us to a final thought for you to maybe ponder. If plasma can transfer these kinds of factors related to inflammation, what else might be in there? What other biological signals or components could be transferred, influencing things we haven't even considered yet? And as we explore interventions like this, messing with fundamental aspects of aging and health, what kind of ethical guardrails do we need?
That's a huge question. The downstream effects, the societal implications.
Yeah. It's definitely fascinating research, but it also requires us, you, the listener included, to think critically, stay informed, and really understand the difference between exciting scientific possibility and proven medical reality.
Well said.
Thanks for joining us for this deep dive.